Hello, I'm Dr. Devayani Barve, a cosmetic and plastic surgeon. Today, I'm going to explain clearly the difference between breast lift, fat grafting, and implants. Because many patients are confused about which procedure they actually need. The key is understanding whether your concern is volume or shape or position, or a combination of these. When patients come in for consultation, they often say, I want my breasts to look better. But better can mean very different things. Some women are unhappy with the sagging after pregnancy or weight loss. Some feel they have lost fullness in the upper part of the breast. Others want an increase in the size. These are three separate concerns and each one requires a different surgical approach. Let's first talk about mastopexy or a breast lift. A lift is performed when the primary issue is sagging, which medically we call as ptosis. Over time, due to pregnancy, breastfeeding, weight changes, or aging, the skin stretches and the nipple descends. In a breast lift, we remove the excess skin, reshape the breast tissue, and reposition the nipple to a more youthful level. A lift improves shape and elevation, but it does not significantly increase the size. Many patients are surprised by this. If the volume is adequate but the position is low, lift alone may be sufficient. Now let's discuss fat grafting. Fat grafting is done when a patient desires a modest increase in fullness with a very natural feel. We harvest fat from areas like the abdomen or thighs, process it carefully, and inject it into the breast in small controlled layers. However, fat grafting can increase up to 1 to 1.5 cup size at a time. It does not create dramatic enlargement. It provides subtle enhancement, improves contour irregularities, and can improve upper pole fullness. But most importantly, it doesn't add any scars. It is important to understand that not all of the transplanted fat survives. Typically, 1/3 is absorbed by the body. Therefore, expectations must be realistic. Then we have implants, which provide predictable and significant volume increase. They are considered when a patient desires noticeable enlargement beyond what fat grafting can achieve. Implant surgery involves choices such as size, shape, placement, and incision type. It requires detailed discussion and planning. Sometimes patients require a combination, for example, a lift with an implant, or a lift with fat grafting, depending on the anatomy and goals. Now, who is an ideal candidate for each of these? A woman satisfied with her breast size but unhappy with sagging may benefit from a lift alone. A woman wanting mild enhancement and natural softness may consider fat grafting. But someone wanting a significant size increase may need implants. Recovery varies slightly depending on the procedure, but generally includes some swelling, use of support garments, and gradual settling of the size and shape over weeks to months. The most important thing to understand is that breast surgery is highly individualized. No single procedure is best for everyone. A thorough examination and honest discussion are essential. Breast surgery should be based on anatomy, goals, and realistic expectations. A detailed consultation helps determine the safest and the most appropriate approach for you. Thank you for watching.